Have you ever felt a persistent itch somewhere on your body and simply thought it was dry skin, or perhaps a passing allergy? Well, know that in some cases, this itch can be much more than just a nuisance. It could be the first sign that something serious is going on inside your body. And the scariest thing, this symptom can appear months before any other sign of illness. Most people ignore this itch, blaming it on the weather, a new soap, or even age. However, recent research has shown something that deserves attention. Localized and persistent itching, especially in specific areas, can be the first warning sign of some types of cancer, such as lymphoma, pancreatic cancer, and even breast cancer. What makes this even more alarming is what was revealed by a study published in Journal of the American Academy of Dermatology. According to researchers, 84% of patients diagnosed with certain types of blood cancer reported experiencing unexplained itching before any other symptoms. In other words, nearly 9 in 10 people were being warned by their own bodies, but they didn't understand the signal. And often, neither did their doctors. If you're over 60, it's a good idea to pay extra attention. This is because, as we age, our skin tends to become drier, which can hide important signs like these. The good news is that there are specific patterns that help differentiate simple dry skin from something that requires immediate attention. And that's exactly what we're going to talk about in this video. I'll show you the 5 body locations where itching often appears as a silent but serious sign that something is wrong. Each of these areas is linked to a specific type of cancer, and knowing this can make all the difference in your life. I'll explain how to identify the right signs and when to seek medical help. But first, let me introduce myself. I'm Miss Ana Laura, and it's a pleasure to be here with you. Please share your views in the comments below. We read them all with love, and if you haven't already, please subscribe to the channel and turn on notifications. Our commitment here is to share health information that can truly save lives. If this information is already helpful to you, comment 1 below. If it still doesn't make sense, type 0. Your participation helps bring this content to more people who need it, especially the elderly, who often lack access to this type of information. Now, let's get straight to the point. Sign number 1, persistent itching in the legs, especially the shins. It may seem common, but pay attention. Many older people report constant itching on their legs, especially their shins and calves. And the strangest thing, no redness, no spots, no peeling, and no improvement with moisturizer. When this symptom appears out of the blue, it's often attributed to dry skin caused by aging. But what many don't know is that this was one of the first symptoms reported by thousands of patients who were later diagnosed with Hodgkin's lymphoma, a type of cancer that affects the lymphatic system. And why does this happen? Lymphoma attacks our body's defense system, and as cancer cells multiply, they release substances called cytokines, inflammatory compounds that irritate the skin's nerves. And for some reason still under study, these substances seem to accumulate more intensely in the lower limbs, especially the legs. The result? An intense itching, almost like a burning sensation coming from deep within the skin, even if everything appears normal on the outside. The most treacherous thing about all this is that the skin appears completely healthy. There are no rashes, no visible signs, just a persistent itch, which usually worsens at night and doesn't respond to any type of lotion or cream. Let me tell you George's story. He was 78 years old, a retired mechanic of the kind who prided himself on never complaining about anything. Strong and resilient, he always said the pain was all in his head. But for 6 months, every night, he scratched his shins until they bled. It was an itch that wouldn't go away, and he tried to ignore it. His worried wife tried everything. She changed the laundry detergent, bought new pajamas, and went through an entire pharmacy's worth of creams. Nothing helped. One day, during a routine blood pressure check, George decided to mention it to the doctor, almost casually. At first, the doctor thought it was just dry skin, a common occurrence at a young age. But there was something about the complaint that bothered him. Just in case, he ordered some simple blood tests. Then came the surprise. His white blood cell count was altered. Later, imaging tests revealed enlarged lymph nodes in his chest. The diagnosis? Hodgkin's lymphoma, still in its early stages. George was shocked. "The only thing I felt was that itch," he said. "If I had kept quiet, if my doctor hadn't paid attention, it might have been too late." This story shows something very important. The difference between a common itch and an itch that could be a sign of cancer is not what you see, but what you don't feel better if you've already changed your soap, moisturizer, and bedding, and the itching still persists for weeks or even months, it's time to take a step further, especially if you're over 60. At this stage of life, the body changes, and warning signs can be more subtle. Often, there's no pain or visible lump, but the nervous system reacts, and itching can be the first sign that something is wrong. Let's now move on to the second location on the body that could hide one of these silent alerts: the upper back, between the shoulder blades. It may seem strange, but persistent itching in this region has been associated, in several documented cases, with pancreatic cancer, and the most curious thing, it usually appears months before the classic symptoms, such as abdominal pain, weight loss, or yellowing of the skin and eyes. The medical explanation is as follows. When tumors form in the pancreas, they can begin to block the bile ducts, the pathways that transport bile from the liver to the intestines. When this bile doesn't flow as it should, its components, especially bile salts, end up accumulating in the blood, and that's where the problem begins. These salts irritate nerve endings throughout the body, but especially in areas where the nerves are most sensitive, like between the shoulder blades. It's not a superficial itch, the kind that can be relieved with a little scratching. Patients often describe it as a deep sensation, almost like an internal tingling, that scratching doesn't resolve. It's the kind of itch that wakes you up in the middle of the night. It makes you rub yourself against the back of your chair, try everything you have at home, creams, ice, a hot water bottle, and still nothing works. Alinda, a 72-year-old former teacher, experienced exactly this. She told me she felt like she had an itch she couldn't reach, even though she could perfectly touch the spot. It was like it was coming from inside my body, she said. For 4 months, she tried everything, changing her mattress, changing the fabric of her clothes, getting massages. She even thought she had a nerve problem. But everything changed when she went to the doctor, concerned about unexplained fatigue. Simple blood tests revealed elevated liver enzymes, a possible sign of something affecting her liver or biliary system. Further tests confirmed it was pancreatic cancer, still in its early stages. Linda's imaging revealed a small tumor on her pancreas, right where it was pressing on the bile duct. And the most striking thing? The itching between her shoulder blades was teasingly a symptom she'd had for months. No abdominal pain, no weight loss, no digestive discomfort. Just that persistent, deep, uncontrollable itch, right in the middle of her back. If you're experiencing this kind of persistent itch on your upper back, especially if it's accompanied by dark urine, pale stools, or unexplained fatigue, please don't ignore them. These isolated signs may seem minor, but together, they could be pointing to a serious problem that requires urgent medical attention. Now, let's go to the third location, where an itch can hide something much more serious: the scalp. Yes, the scalp. It seems harmless, right? After all, who hasn't had an itchy head, especially during the winter when the weather is dry? But this particular itch is different. It's not caused by dandruff or a dry scalp. It's an itch that does not pass, even with special shampoos, oils, moisturizers, or any other common treatment. In some cases, this type of itching can be one of the first signs of blood cancer, as leukemia, or even skin cancer located on the scalp itself. And there's something very important here: cancer-related itching. It doesn't look like a normal itch. People describe her as tingling, bites, or even a feeling of burning under the skin. It tends to change location, appears at specific times of the day, and simply does not respond to anything you try. This happens because, in many types of blood cancer, such as leukemia, the immune system begins to act unregulated. Cancer cells multiply, altering the body's chemistry, and triggering inflammatory reactions that affect nerves, including those in the scalp. And that's the story of Henry, a 73-year-old retired mailman. Henry began to feel a severe itch on his scalp, always at the same time, around 3 p.m. At first, he thought it was the cap he wore every day. Then he thought it was the shampoo. He stopped wearing the cap, switched products, tried creams, pomades, and even cut his hair shorter too. Let it breathe. Nothing helped. The itch came every single day, at the same time, with the same intensity, like clockwork. His wife even came to time the episodes, and it was always the same. No redness, no visible lesion, just that internal, uncontrollable itch. It wasn't until his annual checkup that Henry mentioned the symptom to his doctor. A simple blood test, a complete blood count, showed that the white blood cells were altered. The investigation continued, and With a bone marrow biopsy, the diagnosis came: chronic lymphocytic leukemia, still in the beginning. That itch, which seemed so insignificant, was the first and only sign that his body gave, and that's why attention to detail is so important. Many older people already have more sensitive skin or dry scalps, and they think it's normal to feel some discomfort. But the itching caused by cancer is different. Don't go away, does not improve with products, and usually has a strange or fixed pattern. And more, skin cancers. They can also develop on the scalp, especially in bald or sun-exposed areas, places that many men, especially those with baldness, forget to protect with sunscreen. Most often, scalp skin cancer starts with something small, an itchy, dry, or slightly irritated area, nothing too noticeable. But if that itch always persists in the same place and does not improve with time or with common treatments, it's time to investigate. Since the scalp is a difficult area to examine on your own, my suggestion is simple: ask for help. This could be your spouse, a trusted caregiver, or even your hairdresser, someone who can take a close look. Ask them to check for new spots, color changes, different textures, or anything unusual. What if the itch doesn't go away? After 3 weeks, even with shampoos, lotions, or ointments, especially if you're also feeling more tired than usual, or noticing other subtle changes in your body, talk to your doctor. Don't wait. Your body may be trying to tell you something important. By the way, if you're still here with me, following all this and finding this information useful, comment down here. This shows that you're paying attention, and it also helps us get this message to more people who need to know. Now, on to the next sign. Location number 4. Persistent itching in the chest or breasts. This is undoubtedly one of the most overlooked areas when itching is considered a sign of something more serious, but it's also one of the most important to watch closely. Constant itching on the chest, especially around the nipples, under the breasts, or along the side of the rib cage, may be one of the first signs of inflammatory breast cancer or tumors that develop near the breast. The big danger here is that this itch often appears before any lump or visible change. Sometimes the skin may feel a little warmer, rougher, or have a slightly different texture, but most of the time, there's no obvious external signs, just that constant uncomfortable feeling that it does not improve with moisturizers, changing bras, creams, or lotions. Inflammatory breast cancer, in particular, does not follow the pattern that many people know. Many women wait for a lump to become concerned. But with this type of cancer, the first symptoms are different. There may be itching, warmth, a certain heaviness in the breast, or subtle changes in the skin, without anything visibly wrong. And this type of cancer is aggressive. It grows quickly. Therefore, recognizing it, these initial signs can make all the difference. Ruth, a 69-year-old grandmother, went through exactly this. She began to notice a strange itch around her right breast. It wasn't intense, but it was always there. As the day went on, it seemed to get worse. She thought it was her tight bra and changed hers. Then she thought it was the laundry detergent and changed hers. She even stopped wearing a bra for a few days, thinking it was a diaper rash. Nothing worked. The itching was always in the same place. It was only after weeks that she decided to schedule a checkup. During the consultation, the doctor noticed some small dimples in the skin, almost invisible, that Ruth herself had not noticed. Tests revealed a small but aggressive tumor, growing just below the surface of the skin. "I thought it was just my age, or my old bra," she later said. "I never imagined that a simple itch was cancer trying to warn me." Now, a very important point. This type of itching is not exclusive to women. Men can also get breast cancer, and because it's rarer, the signs are even easier to miss. An itch near the nipple, an area of thickened skin, persistent discomfort below the pectoral muscle. These may seem trivial, but in men over 60 years of age, these symptoms deserve to be taken seriously. It's not about panic. It's about awareness. The body speaks. Sometimes it just whispers. We need to be willing to listen. In some cases, that constant itching in the chest area, or around the breasts, can also be linked to changes in the lymph nodes, especially under the collarbone or in the armpits. When these nodes become enlarged or inflamed, they can cause discomfort, a feeling of heaviness or heat, and yes, persistent itching. These changes may indicate lymphoma, or even the spread of other cancers to nearby lymph nodes. And here's a powerful reminder. Early detection does not depend only on sophisticated tests or expensive machines. Often it starts with something much simpler. Pay attention to what is different about your body, even when it seems insignificant or a thing of age. Area number 5. Persistent itching in the genital or anal region. This is, without a doubt, the most delicate area to talk about, but it is also one of the most important. Most people associate itching in this area with common causes: hemorrhoids, hygiene, rough toilet paper, tight clothing, or even age-related changes. And in most cases, it's actually benign, but when the itching becomes chronic, does not improve with the usual treatments, and is accompanied by burning, pain, or stinging sensation, could be a sign of cancer. This type of symptom may be related to anal cancer, vulva, in women, or of penis, in men, especially in people over 60 years of age. And that's exactly what happened with the Eugene, a 76-year-old retiree. He almost passed a whole year dealing with a persistent itch in the anal area. I thought it was hemorrhoid. He tried everything: pharmacy creams, sitz baths, changed his diet, bought cushions to sit more comfortably, but the discomfort always returned. Some days it was stronger, others milder, but never disappeared completely. It was only at his wife's insistence that Eugene finally sought medical help. The examination revealed asmal injury in the anal canal, a tumor still in its early stages, which would have continued to grow silently if he had not taken that action. I was ashamed to talk about it, he told me, but that shame could have cost me my life. And in the case of women, especially over 60 years old, one of the most silent, and often ignored, types of cancer is vulvar cancer. It is a disease considered rare, but its incidence increases with age. The first sign is usually a persistent itch on the outer part of the genital area. Over time, the skin may become thinner, rougher, or slightly discolored. Many of these symptoms are mistaken for natural dryness of menopause or hormonal changes. And yes, sometimes that's all it is, but not always. If this itch continues for weeks or months, if it gets worse at night and not respond to creams, oils, or any other treatment, do not ignore. See a gynecologist or dermatologist. Sometimes the most subtle signs are the most important. The genital and anal regions have many nerve endings. Therefore, they also function as early warning systems of our body. If something is not right, this sensitivity can be the first place where symptoms appear. And yes, sometimes they come in the form of persistent itching. To conclude, if you've made it this far, congratulations. I know this isn't the kind of conversation that's comfortable, but it's exactly the kind of information that can save lives. Itching is common, but when it is persistent, always located in the same place, and do not improve with simple changes in the environment, products, or routine, they may be the first whisper of something much bigger. And the sooner you hear that signal, the greater the chance of acting in time. If any of these stories reminded you of something you're feeling, or something someone in your family has said recently, don't leave it for later. Talk to a doctor. Get checked. Ask your questions. And if this content made sense to you, comment below with the number 5, so I know you stuck with me until the end. This helps us bring this information to more people who, like you, deserve access to preventive and informed care. That's what we're here for. Clear, truthful, and human information. Always. The truth is that behind many cases of persistent itching may be invisible internal changes, such as abnormal cell growth, inflammation of the nerves, or swollen lymph nodes. And when this itch always appears in the same side or in a specific area of the body for weeks at a time, can be one of the first signs that something is not right. And here is the most important message of all. Discomfort should never be a reason for silence. Seek medical help. It is not a reason to be ashamed, much less exaggeration. Health professionals are trained to listen, welcome, and treat even the most delicate symptoms with respect and compassion. Talking about these discomforts, even when they seem small or embarrassing, can be the key to early detection, to better chances of treatment, and to your peace of mind. If you've made it this far and are following this series closely, please comment down here. This helps us continue producing content that can really save lives. And now, if any of the signs you saw here today seem familiar, let's get to the most important part. What to do if you recognize these signs. 1. Observe. Start by paying attention to the itch. When does she appear? How long does it last? Where exactly is it located? What kind of sensation is it? Burning, tingling, deep itching? What have you tried to relieve it? And did it work? Write everything down. This information will be very useful for the doctor to make an accurate assessment. 2. Don't wait for other symptoms to appear. The itching associated with cancer often appears months before any other sign. Don't wait for pain, lumps, or spots. The sooner the problem is identified, the greater the chance of solving it successfully. 3. Speak clearly with your doctor. Don't just say, "I have an itch." Be specific. Describe the location, frequency, duration, and intensity. Say you read about it. Possible link between certain types of itching and cancer. This helps the professional consider investigations that might not be done in a quick consultation. 4. Seek a second opinion if necessary. If you feel that your complaint has not been taken seriously, don't be afraid to insist. Find another professional, or ask for a referral to a specialist. You know your body better than anyone else. 5. Remember, most itches are not cancer. But the only way to be sure is to see a doctor, and that tranquility worth every step. Taking care of your health starts like this, paying attention to the little things your body is trying to tell you. Often, the signs are there, subtle, insistent, just waiting for you to listen. If this content helped you, share with someone who might need it. It may seem like a simple video, but it could be the push someone needs to seek help and completely change the course of their life. And remember, you deserve to live healthily, consciously, and without fear.